the years, MS Teamworks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
Hi, I'm Rachel Stakem, and I'm a nurse practitioner. I have two roles where I help people living with MS. The first is at a care management organization called Independence Care System, or ICS, where we help people with physical disabilities stay healthy and in the community. Many of those people live with MS. I also practice part-time at the Bronx MS Center, which is in the Bronx, as you could guess from the name, and we're about a mile from Yankee Stadium. Generally speaking, even when we talk about health, we see that the answer is different for people in the millennial generation. Millennials have a different definition of what health means compared to older generations. They often include their behaviors, like what they eat and how they exercise, when defining their own health. So if I ask someone, "Are you healthy?" they may say, "No, I haven't been eating well, I've been eating a lot of junk food, and I really haven't been exercising." When posing the same question to someone of an older generation, they will think about sickness encounters, right? Have I been to the hospital? Have I needed to see the doctor because I didn't feel good? So if I ask that same question, they'll reply to me, "I think I'm healthy. I haven't been sick all year." When they're coming in to see for a visit, I also tend to see that the millennial generation is very upfront about the symptoms they are experiencing or what they're struggling with. There is less stigma or hesitation about talking about sensitive topics like sexual dysfunction or mental health and depression. A patient recently came to the clinic and told me that she felt like she had really little energy. She felt like she was in a slump, but had been wondering if it was MS fatigue. So she started paying attention to her daily activities and how she was changing what she typically does. In that process, she realized that the pandemic, because of the pandemic, she wasn't engaging in activities that usually brought her joy, like being with her friends. And prior to the pandemic, she was seeing them 3 or 4 times a week. But now she was staying home because she didn't want to get sick. She came to the conclusion herself that she was depressed about her current situation, and she wanted to talk to me about finding a therapist. She also wanted to talk to me about balancing safety and trying to protect herself while also returning to things that brought her joy. She really led the focus of that visit. I did not. So that's just a quick example of how I see this generation will not only present problems that they are facing, but often they have given thought to what can be contributing to it and how they want to address them. They know exactly what they need help with and are often open to being referred to a specialist if there is a specific outcome that they're hoping for. In contrast with other generations, I may need to spend more time eliciting the issues that they may be facing and then exploring solutions to help address them. For example, in a similar situation, I recently saw a gentleman in his 40s, and I always start the visit the same way, right? "How are you? Has there been any change?" And he said, No, I'm fine. I'm basically the same. But as I asked more specific questions about possible symptoms that can occur with MS, he revealed that he had significant fatigue that was impacting his ability to concentrate at work. And he noticed he was making more mistakes. When I asked him why he didn't tell me this earlier, he said, "If I'm not in agony, then I'm fine. I can manage." And so we spent a lot of time talking about that. The purpose of why I'm here in my role is really to support him and to address those symptoms that can occur from MS. It allowed us to then explore solutions of things that could help him feel less fatigued, like exercise, and going to speech therapist. Together, we were able to identify some interventions that could help address his symptoms. But if I didn't specifically ask about fatigue, I wasn't likely to find out that he was having some challenges. As I mentioned, this generation tends to come prepared for visits. They are very comfortable with technology and have access to information literally at their fingertips. They have often done their homework and come informed on the conditions or symptoms that they are experiencing or being worked up for. They have ideas and impressions that have already started formulating. They've researched what interventions they think could work for them, what resources are available to them. They also tend to pay attention to commentary in social media. So they not only have an idea of what's going on and want to discuss it, but they know where they want to go and where they want to avoid. So if for example, if we say, we've made the decision, like physical therapy will be a good place, they'll say, oh, well, I don't want to go to the place down the block from me because they have a horrible wait time, even though they haven't gone there yet. So they know what they want and how they want to move forward. I've also seen that the millennial generation wants to share their thoughts regarding what's going on and what they want to do. This generation will also have very specific questions that they want the clinician's input on. For example, a fairly new patient recently came and was interested in starting a specific medication. So she looked into that medication and saw that there were a few occurrences of breast cancer reported in the clinical trial. She wanted to go on that medication, but she was concerned because her mother and her aunt had been diagnosed with breast cancer. She asked, when she came to me, she asked me if I could help her figure out how to make sure that she was not a carrier for the BRCA gene. She did not want me to give a general overview of the medication or review the side effects. She had already done that. Instead, I listened to her concerns about what she learned about the medication, and then we had a very focused discussion on risk versus benefit. I think it is very helpful to set up expectations right from the beginning. When I start working with someone, I will ask them what they're looking for in a healthcare provider. What do they value? What drives them crazy when they access the healthcare system? Some of those answers are not surprising. Time is important to millennials. They live and work in New York City, so they're always running around and late for their next appointment. They value efficiency. They are technology loving, where others may be hesitant or resistant to it. They grew up with it. They have loved that telehealth is now an option in our clinics since the pandemic. Along those lines, I ask them how they prefer to communicate and receive information. Again, the answer is usually technology. They prefer email or using apps. They find it convenient and easy. Instead of waiting to have a phone call returned and having me return it when they might not be available, we can catch each other. After I have a sense of what someone is looking for, I can talk to them about what we can offer them at the center, what we can do, and if needed, where we may have challenges to meeting their expectations. I find it's better to be upfront rather than disappointing. Hopefully, we can talk through those potential issues and come up with alternative solutions. For ongoing care, when people come and see me, I begin each visit by asking what they are hoping to get out of our time together. I spend time asking them how they think they are doing in regards to their MS and if they think their current treatment plan is working for them. Their perspective impacts outcomes, and I want to know where they are. It also allows me to ask if I can share with them what I know about MS and either confirm what they are saying or clarify any misconceptions. I have found that stopping before I go to educate someone and asking for their permission to share information allows them to pause for a minute to make sure they are ready to hear it, and then they can hear the information at a deeper level. The most important message that I want viewers to take away is communication, communication, communication. Isn't that always the answer? If you can set up communication strategies from the start, you are likely to have a successful relationship. This is how you can contact me. This is when I'm likely to respond to you. If something is emergent, let's plan on doing this. As clinicians, we're constantly evolving to make sure we can offer different ways of communicating to align with our patient preferences and leverage technology whenever possible. We know that the millennial generation prefers to use technology to communicate. In addition, I think it's really important to get to know someone. This disease is very personal. It can have a big impact on people's lives, so we need to build a relationship. Today, we're talking about the millennial generation and the trends that we have seen in providing care, but so much of this is individual. It is important to know what each person values, what they care about, what brings them joy in life, and what matters to them. If we know this, we can work to preserve it. So if you are a person living with MS, please share this with your clinician. And if you are a clinician, please ask. If we try to guess, we are often wrong, and we are in this journey together.